Feels very aggressive. All right, so I'm going to call this meeting to order here at 8:30 a.m. Hunter, President Barnett will be joining us shortly. I'm going to go ahead and kick it off. So we're going to start with our roll call. Commissioner Geithner.
Here.
Commissioner Nelson.
Here.
Mayor Dixon.
Present.
Councilmember Donaldson.
Here.
Dr. Chan. Is she online? Okay, not yet. All right, and Dr. Collins is excused. Mrs. Ralston.
Here.
All right, and Vice President Salt, I am here. Thank you. We're going to go ahead and move on to approval of the agenda. Do I have a motion?
Mayor Dixon, I'll move to approve.
Doris Ralston, second.
All in favor, say aye.
Aye.
Any opposed? All right, that is approved unanimously. All right, Board of Health comments. Does anyone have any comments they'd like to share this morning?
I'll make a comment. I just want to say it's nice to see all the citizens that are here today. It's always great to have public participation. It helps us make better decisions. So thank you for being here.
I agree. Thank you for being here and being a part of the process. This month, I did have the opportunity to fill in for our liaisons to the chronic disease prevention event. I'm blanking on what we called it. Data walk. It was a data walk with a bunch of great community partners, and it was so much fun to see the work that has gone on behind the scenes come to life and the participation of all of the great partners in the community. So I look forward to that information coming to the rest of the board. It was lots of great discussion, a lot of people really being inspired of like, okay, I can't do that piece, but I can do this piece, and how everyone could work together to really approach chronic disease in our community, and how can we prevent and how can we better equip the community. So that was really great. All right, I need an approval for our minutes from our board meeting on April 22nd, 2026.
Mayor Dixon, if there's no corrections, I'll move to approve.
Can I move both of those minutes at the same time? Can we vote on both of them at one vote?
Yeah, and I'll move both.
You can. Okay, so we're going to move both for the regular meeting and the work session. Mayor Dixon has a motion. Do I have a second?
Second.
Thank you. All in favor, say aye.
Aye.
Aye. Any opposed? All right, that passes unanimously. All right, so now we're going to move to public comment for items scheduled that are not scheduled on the agenda. So if anyone has public comment on anything we will not be discussing today, now would be your chance. Anybody with something we're not discussing today. So if you're going to be talking about the regulation changes, that'll come in a few minutes. But if you have something that's not on the agenda, you're welcome to come and speak now. Yeah, come on up and introduce yourself, please. You'll have 3 minutes.
Listing for the contractors has been altered. It is no longer in alphabetical order and favors outside resources from other counties coming into El Paso. And I'm asking that the council actually address this problem and return it back to alphabetical order, so we can have it'll list the proper individuals in our area, and also be in alphabetical order. We're the only county, only state that is faced with this problem. It's been changed since about 5 years back.
Can you state your name for the record, please, sir?
Dennis Williams. Thank you.
Thank you. Anyone else? All right. Then we'll move on to item number 6.
Vice President Salt, before you move
Yes.
on, could I ask for some assistance? My computer is not, it's locked, and I don't know. I'm not seeing the information. Thank you.
All right, we're going to move on to our finance and budget discussion with Budget Manager Lauren Mearmont.
Good morning. Lauren Miramont, Budget Manager. I don't have much new to report since last meeting, but I am still going to walk through the April report, especially since there's so many people from the public here. So we do a monthly presentation. We review our budget and our actuals and a status each month. So we discuss our revenue, sources, and activity. So our El Paso County revenue is resources given to public health from El Paso County. It's an annual allocation, and for 2026, it's $7.2 million for the budget. At this point in time, we have received about $2.4 million, and that's a monthly allocation. We will receive that full $7.2 throughout the course of the year. It's a steady revenue source. Our state LPHA funding is resources given to us from the state of Colorado. It's a formula-derived funding source that's discretionary, and that is given to us quarterly. We are allocated $1.5 million for 2026, and we've received the first quarter so far, but that will track on schedule for the year. Our program-specific grants are, as described, we receive grant funding for specific programs that have specific scope of work, and we are reimbursed for those activities. So we spend the money and then we receive a reimbursement. So we expect to be reimbursed $12.7 million for the year, but that's based on our spending. So if we spend less, we are reimbursed less. And right now we are tracking that we are spending less, still accomplishing the work, and then that may catch up throughout the year. So it's just a point in time activity. Right now we're 3.6 million of our 12.6 million for 2026. Our licenses, fees, and permits are revenue generated from fee-for-service activities. There's a variety of activities included in here. This is all of our fee-for-service revenue, including our vital records, our environmental health activities, some lab services, et cetera. So we expect to receive $4.2 million for 2026, and we are tracking really well with that, with more than half already received for the year. Medicaid fees and insurance is, as described, we are able to bill for certain services we provide, and then that is a cost recovery for those services. We are tracking low for the year, as discussed in the last board meeting. Don't really have anything to add for that, but if you have questions, please let me know. But nothing's changed for that. Interest income is income earned on our investments as managed by the treasurer for the county. So those policies are set by the treasurer, but we are able to earn a little bit of interest on investments from our balance. And that is about $200,000 annually, so a small portion of our total revenue, but we're tracking well for the year to date for that source. And then contributions, donations, and miscellaneous is a variety of revenue sources, obviously very small with only $20,000 for 2026, but that includes some activities like our lease to the City of Fountain at our South Building and other various miscellaneous revenues, and we're also tracking well for that. Any questions on revenue before I move on? So then expenditures are three big buckets: personnel, operating, and capital. Personnel is our biggest expenditure because we're a service agency, and of the $20 million, $20.5 million we have budgeted for 2026, we've expended about $6 million to date, and so that is under. For this point in time, we have some vacancy savings, and that's then reflected in our program-specific grant reimbursements also. And then operating, we're budgeted at $5.8 million for the year, and currently sitting at 1.7. and I see a comma out of place, but that's okay. But we're underspent for the year for that, for our operating at this point in time. Also, in capital for this year, we have budgeted $255,000 for some vehicle purchases and for a audiovisual system upgrade, and we've made some progress in the project for the audiovisual system upgrade. So this month we have some actual expenditures of $31.5 thousand towards that project. But overall tracking under in expenditures and under in revenue, but it's correlated. So that's what I had to share.
Commissioner Geithner?
Yeah, I just, you mentioned that there was some progress on the audiovisual. Do we have any updates on the vehicle purchases?
Yes, we are anticipating delivery of those in late June or early July.
Any other questions? All right, thank you, Lauren. All right, and now we're going to move on to our public hearing portion of the meeting. We're going to start, I'm sorry, let me catch up on my notes here. Okay. Okay. So we are going to start with our presentation from staff. Kat McIver, if you come on, join us up here.
All right. Well, thank you. I'm Kat McGarvey, the Environmental Health Division Director for El Paso County Public Health. You've seen me for the last 4 months at this point. So today we're going to go through and just kind of give a brief overview of the work that we've done with the board and with our stakeholders for the last several months as we've gone through this process. That's going to include a little bit about the OWTS history and significance, regulatory revision process, notable required changes, and optional regulatory changes. So a little bit about the history and significance. I do think this is important just to bring us up to speed and where we're at today and why we got there. So in 1973 was the first regulation. It was titled Individual Sewage Disposal System Regulation. So I have the word disposal there in bold for a very specific purpose. So during that time, it was, these are going to be a temporary solution until we have central sanitation throughout all livable spaces. And as time went on, we found that that just wasn't going to be the realistic possibility. And so in 2012, it was recognized that these systems do present a public health risk if not properly cared for, installed, and maintained. So in 2012, the OWTS Act, April 26, 2012 to be exact, I believe, was approved and put into play. This is a significant shift from disposal to treatment and making sure that the wastewater that is recharging our aquifers, recharging our groundwater systems is treated prior to re-entering that system. So the public health significance of this is to preserve the environment, protect public health and water quality. It is in the best interest of the public to establish minimum standards for on-site wastewater treatment systems. And so that is in both Regulation 43 and our local regulation. So the regulatory revision process. CDPHE is Regulation 43. They went through a regulation revision process. They set the standard for all the regulations where local public health agencies or local municipalities then have to come into compliance and or operate under Regulation 43 as it is. So from August 2023 through June 2025, the state undertook several stakeholder meetings, including several subgroups, about 30 different subgroups, to refine the regulations.
Can we take a quick question?
Yeah.
Oh, I thought you had a question, sorry.
Okay. Yep. No, at any time if you have questions, just let me know. So really this process was to refine the regulations to really bring some clarity to some areas that were not as clear as they could be or maybe didn't necessarily fit within the scope of what Colorado has in its uniqueness and what we need to do for Colorado. CDPHE's specific role is to ensure consistency throughout all local applications, as well as provide technology review and approval. And so in addition to setting the minimum standards, they ensure consistency and provide those technology reviews. What we do in Chapter 8, then we now have to come into compliance with the Reg 43. So Reg 43 was approved in June 2025. That then gives us a year to bring our regulation into compliance with Reg 43. And so we have done that through a series of stakeholder meetings, both with our industry members, public, and as well as our board. And so we have now aligned our local regulations with Regulation 43, meaning we have to be at a minimum as stringent as or more stringent than. Our role in this is to administer all aspects of the OWTS regulations locally, and the board has options to determine what optional programs we will or will not include in our regulations. So a little bit about what our process looked like. We started in June, shortly after Reg 43 became effective. July through October, we spent some time aligning our regulation, doing some red line version and incorporating the Reg 43 changes into Chapter 8. November through December, we held 3 technical advisory group meetings. Our technical advisory group consists of engineers, designers, installers, certified inspectors in operation and maintenance, as well as some suppliers also attend our meetings for our technical advisory group as well. After each of those sessions, we did post the sections and the changes that we discussed in that stakeholder process open to the entire industry, sent an email out, let them all know that they had the ability to provide comment on those as well. January through April of this year, we held several work sessions with the board to be able to bring the education, awareness to what we were doing, as well as seek your feedback and input. And that brings us now to today, May 27th, our public hearing. And based on some of your feedback and input between April and May, I did also meet with Pikes Peak Regional Building and discuss some of their changes and how we can more closely mirror some of their processes as well. Today, the ask will be that we vote on the regulations as presented or discuss any changes necessary with the intent that these become effective July 11th, 2026. After the adoption process, there's a 45-day period before they become effective. Some notable required changes. So these are the required changes that we are required to bring into our regulations from Reg 43. Just a brief overview about what those look like. There was a lot of definition and language consistency and clarity that was implemented. Soils, there's an introduction of cementation, rupture resistance, and some clarification to bedrock. Wastewater design flows were clarified, setbacks were clarified, as well as mound system design parameters. And then there was an introduction or inclusion of design parameters specific for disinfection technology. So this is a new treatment technology that's being introduced as an option to install on systems. And then also secondary safety measures for tanks. Optional regulatory sections. This is where board decision will be needed on these optional sections. Licensing of industry professionals, variances, operation and maintenance, as well as certified inspections. And so we're going to go through each one of these. The licensing of industry professionals, the option here is that a local board of health may adopt these regulations that provide for licensing of systems, contractors, cleaners, maintenance providers, and certified inspectors. The rationale for this is that if we can maintain some minimum standards, we safeguard public health, we protect water quality, and we ensure sustainable development in both rural and urban communities through having a minimum standard established for all contractors operating within this industry. CDPHE Regulation 43, it provides authority to local public health agencies, specifically El Paso County Public Health, to license, but does not set the minimum standards. So the minimum standards are set locally. Reg 43 just gives us the ability to set those standards. Overview of optional licensing and certification. So here's an overview of kind of where we're at and what we've done in this section. We do allow licensing of contractors, system cleaners, maintenance providers, and certified inspectors. We have historically licensed or certified all of these industries. It supports, again, our public health, water quality, and maintains sustainable treatment systems. The scope of change here is that we continue licensing contractors, cleaners, and inspectors We've added an corrective education requirement for system designers, so we'll talk a little bit more about what that looks like on the next slide. And we've also introduced updated incentivized renewal pathways for licenses and certifications after one standard renewal cycle. That aligns with the and mirrors PPRBD's approach as well. Summary of these changes, for system contractors, we're going to continue licensing, and we've added a new automatic renewal and fee waiver path after that standard renewal cycle. For system cleaners, we are going to move away from truck inspections to company licensing, which will require a national or an approved certification course, and then after an initial renewal cycle or one standard renewal cycle, there will be a renewal fee waiver process for that. Maintenance providers and certified inspectors, we're going to continue certification and also introduce a new fee waiver path. And for system designers, this looks like corrective education if soils reports or designs require frequent intervention and revision. And so we spend a lot of time not being able to efficiently move things through because we have to request revisions multiple times. And so what we've done here, instead of requesting at the board direction, moving towards really focusing on those where we need to support more, and those who are meeting those standards don't have, it's not a requirement for all. Why these matter, again, public health and environmental protection, it provides baseline requirements and recourse if these minimum standards are not met. We align local regulations with requirements of Reg 43, or the allowance in Reg 43 that allows us to license and certify. It reduces the burden and incentivizes compliant professionals while improving our design quality and increasing efficiency. So the decision needing here would be on licensing options. The draft does reflect our updates requested during the April 2022 work session, and then with these updates, we do recommend approval of these licensing options. For variances is our next optional section. The board may adopt variance procedures that are as stringent as Reg 43 or more stringent than, but the board is not required to adopt these in any capacity. The purpose here is this section does provide us a procedure for local public health agencies to consider variances from design and siting requirements. It really helps us work through challenging lots, is what this section does. Historically, we have allowed variance requests. For Reg 43, the added requirements for consideration of variance requests when cesspools are identified, but the property is unable to support a conforming system. So that is a Reg 43 requirement of the variances, a variance section. There are specific amendments to when the cesspool is identified for us to be able to bring that to conforming status. The scope of change for El Paso County, we cannot grant a variance on a cesspool that is in a state of failure, and so that has just been clarified in our regulations where we would prohibit a variance request on a cesspool that is in a state of failure. So the decision needed here for variances is that the draft includes clarification consistent with Reg 43 related to failing cesspools. This is an update that we recommend including in our regulations. Our operation and maintenance inspections. Again, this is an optional program. Local Board of Health may adopt these procedures or more stringent procedures, but is not required to adopt any provisions for operation and maintenance. The purpose for operation and maintenance is it does allow for a reduced setback distance and system size only in the presence of operation and maintenance programs. So we cannot permit, we would have to design everything at the minimum treatment level 1 standard if we do not have an operation and maintenance program. We have historically had provisions for operation and maintenance, and so there are no substantial changes to this in Reg 43 or in El Paso County's local Chapter 8 regulation. But the important aspect here is we do lose the ability to maintain flexibility on challenging lots. So even in the event of installation of advanced treatment, we would have to design those at the minimum requirement, and that would substantially impact the ability to put conforming systems on many lots in the county. So again, the decision here for the board is to retain the O&M oversight, preserve flexibility for El Paso County property owners, we definitely recommend keeping this particular provision within our regulations. Certified system inspections. Again, this is an optional program. The local Board of Health may adopt these procedures or more stringent procedures, but is not required to adopt any provisions for system inspections. The purpose here would be to protect public health and the environment by ensuring that we have septic systems that are operating safely, comply with the regulations, and prevent contamination of our ecosystems, including land, air, and our water systems. We have historically had provisions for certified inspections at time of property sale within our regulations, and that is currently how it is written in the effective regulation now. Regulation 43 amendments to this program would be the addition of when a cesspool is identified at time of property sale, that must be brought into conforming status. This is an incremental step in the protection of groundwater. The scope of this change for El Paso County would be to remove the requirement to conduct at a time of property sale and maintain this as a voluntary inspection provision. What happens with a voluntary approach is we're likely to see an increase in enforcement action without a defined inspection interval. It reduces options for repairs because we would then only likely be notified and have input at time of system failure, which gives us much less flexibility and many less options to help property owners. And we would not be able to offer reductions for use of alternative options such as composting toilets. The decision needed here is following our April work session, the current draft reflects a voluntary approach to these inspections. It establishes parameters necessary to support this approach. And El Paso County recommends adopting the optional inspection provisions. So in total, why does this all matter? Why are we changing our regulations? Really, we need to ensure public health and environmental protection through responsible system design, balance flexibility with accountability via local oversight, and support sustainable growth while maintaining safety standards. Required changes, we must adopt the minimum required changes to maintain compliance with Regulation 43. Optional changes, the board is asked to take action on licensing, variance, O&M, and certified inspection options. For awareness, we have submitted to CDPHE. They have had initial review of that. They do not have any substantial concerns with what we have submitted to them. And so at the end of this, we recommend adoption of these draft regulations. Any questions for me?
Yes, Councilman Dennison.
Yeah. Thank you, Madam President. And Kat, the one that concerns me is it's item 4, certified system inspections. We do currently have inspections at the time of sale, but what's being proposed, unless it's amended, is to change that to only voluntary. What are the public health impacts of doing that?
Sure. So, these systems, while they exist on an individual's property, once the water enters the ground, that does leave individuals' property. And so we have seen, we don't see it often here because we have this program in place where we are inspecting them early. We are inspecting them at points, at predictable points where we can help identify systems before they become more catastrophic and cost more. Because most people, these are underground, and so you're not going to know if there's a problem until it starts to surface or it backs up into your home. And so by inspecting them at a defined point in time, that gives us an ability to look into the system and identify potential concerns, problems, and provide education and awareness, and giving both the buyer and the seller an ability to work through that process and identify what they are willing to take ownership of or negotiate in process of that sale. The public health impacts is once that water, if it's not treated appropriately, enters our groundwater system, that's being pulled up through wells, that's being pulled up through drinking water wells out east. It can surface. Many times we don't know that there's going to be surfacing until it leaves a property. And these are things that we can identify through a defined inspection point.
Okay, and the defined inspection points right now are at the time of sale, and what other points?
Through operation and maintenance. So those systems that meet the requirements for operation and maintenance, those are inspected annually. Those inspections do apply towards the property sale program, so they aren't doubling those inspections. But those are our two defined points in time for operational type inspections.
And can you just review for me, what's the benefit of changing this to making it optional, not continuing with the way we do it now?
Sure. So provided direction from the board, we pivoted to a voluntary approach at the direction and request of the board. This still allows the ability to seek this as an optional provision. I know some of the concern is that this falls on the seller of the property and not the buyer of the property. And in my conversations with CDPHE, the reason that happened at the state level is because of the liability aspects of that. Having somebody who doesn't own that property, coordinating somebody being on a property is a lot harder. And if there were damage to the system, what is the liability aspect of that? And so, that is a concern through the industry, that this likely belongs more on the buyer, but because of the nature of it being on property owned by somebody else at that point in time, it falls on the seller. So
The seller could always ask for that as part of the transaction fees.
In a voluntary approach, it's my understanding that this then empowers the buyer to be more proactive in that situation.
Okay. Anything else you'd like to add to that?
At this point, if there's other questions, I'm happy to address that, but.
Mayor Dixon?
Yeah, so some of these systems have been around for decades, if not 100 years. Do we have any data that actually suggests that they are causing a problem?
So we don't test systems, right? Like as part of public health, we do not have that. Because it's not something that we engage in. There is lots of data out there that suggest, for example, in Hawaii, they actually have less than 5 years to bring all of their cesspools into compliance and into conforming status because of the substantial data and impacts that the cesspools within that community are having on the environment. Because we're local public health, we don't have data, we don't do testing, we don't have that piece of that, but there's lots of industry members here who I'm sure are willing to share that with you.
Okay, thank you.
Yep.
Commissioner Geithner?
I just want to follow up, since Kat didn't share this part of the conversation when we had our work session. I know you had to leave a bit early. So a lot of the conversation around the reasoning on moving away from that program has to do with what she said is based on if there's an issue, not based on what those inspections actually do. I would disagree with the fact that that there is a defined point in time inspection when you're talking about sales. Some homes are going to be sold once, some homes will be sold never in a 25-year period. So I think we're overstating what the interval actually is and the consistency on that. And I think in addition to that, speaking to realtors in the community and others, the questions around, is this a necessary policy and is it actually getting to the crux of what we're hoping to achieve? And I think at the end of the day, we all think that leaking things into our water system is bad, right? I think we can all agree on that. The question is, does this policy actually do a lot to curb that? Again, when you have people who have 5, 10 years, 25 years they live in a home, there's going to be no inspection. And so I think it's an extra burden, but also speaking to our realtor community, this is already something that is going to happen, to be honest with you, without this. And that is because realtors are going to require, as I spoke to many of them, they're like, oh, absolutely. And not only that, but they often require, and I say require, they're advising, right, their clients, because they know that these are potential issues, and that's the entire job of the realtor, right, is to protect their client in this process. And so not only are they going to continue to encourage these inspections, which is why I think having a voluntary and having a way for them to interact with public health, and that was discussed, is like we still want them to be able to have that avenue to connect with public health if necessary. But at the same point, yeah, I'm sorry. It's way back here. At the same point, there are lots of different areas of a home that are not regulated in the same way. So it just seems like this is already taken care of in the private sector by realtors who are part of that protection process in that entire process. But what it does allow is flexibility. And also, Kat, I think, several times when we've had these conversations, that inspection is a snapshot. So I remember Dr. Chan specifically asking, well, how long is this inspection good for? And the question was, there is no time period when your inspection is good for. So also, they could be inspected at the time of sale, not know how to use their septic system, and 2 weeks later it could be failing. So again, what is really the protection when that is the case? So those are some of the things that we really discussed around whether or not this continues to be a beneficial program, whether there are not already other avenues and other ways that are happening in the private sector through that realtor connection that most people are having. We also, I brought up from a consumer protection perspective, most of us who live in a home that is connected to a municipal wastewater system, we are also responsible for that from our house to the street. Those can also be incredibly costly repairs, and those are, again, things that a realtor is again, they can't require, but they're telling their client, you want to get that inspected. One of the realtors I spoke to said, I absolutely just had this situation where it was a $10,000 thing that we caught. So again, those things, if we're talking about consumer protection, are really already happening through other avenues, and we're just adding a layer of bureaucracy to that process. So again, creating the hope from that conversation was that we can create a voluntary where that we are still serving residents so that they can interact with public health and get the answers that they need if they need help with their septic system, but at the same time not layering in bureaucracy where we already have a private sector piece really working, and realizing that, again, it doesn't create, in my mind, either any assurance that that septic system is going to be good for any amount of time following that, and it just does away with that layer of bureaucracy, considering all of that.
Just a couple thoughts. One is that I look forward to comments from those who are here. I think it'll help give some experience to this, personal experience. Two, you mentioned Commissioner Gott, you mentioned that your line from your house out to the main line under the street for septic, it's the homeowner's responsibility. And you're exactly right. And our realtor did not advise us to have that done, and it failed like a year later and backed up into the basement. So it would be nice if all realtors recommended that to their clients, or, hey, we need to have your septic system scoped, or whatever, however they do it. I know it doesn't always happen because our realtor didn't do that with us. And then number two is if it's already being done by advice from realtors, then I don't see that this is a burden if they're going to do it anyway for us to maintain the standard that we have now as a protection. But I'll be, real curious to see what those in the industry have to say on it. And but thank you for filling me in on the part I missed. Appreciate it. Was there anything after that discussion that you want to add?
No, I think that sums up some of it. I think hearing from the industry will probably be beneficial. We do know that fundamentally not every property that should go through this already does not go through this, so we already know that it is not wholly being done by the industry. And so we do, for example, I know when I pulled the data specific to Green Mountain Falls, of 290 transactions over the course of a 2-year period, only 90 of those went through the process. And so, we know fundamentally that, and I talked to 10 to 20 people a month where they didn't go through this process, and it's been very impactful too.
And what 2 years were those? Do you know? Was
24
it recent?
and 25.
24 and 25. And I think one of the things you pointed out before I had to leave last meeting was that what can happen, or I don't know if it often happens, but potentially happens, is a home sells, like from an elderly couple that has very little use on the septic system, because there's only 2 of them, and they know what their system can handle. and then a new home owner buys it with 2 or 3 kids, or just themselves, they use it differently, and failure occurs. And that the inspection could catch things that could prevent
You
that,
know,
right?
I mean,
it's
sometimes
going.
yes, sometimes no.
Yeah.
Nothing is
Good.
perfect. Not everything is always going to be caught in that aspect.
Understood. Thank
Yep.
you.
Commissioner Nelson?
I just wanted to follow up on some of Commissioner Geithner's points, and just to say it out loud, we are not the ones conducting the inspections, correct? The Department of Public Health. They are third parties being hired.
They are conducted by certified inspectors that are not employed by El Paso County Public Health.
So it's just sort of another layer of government requiring something of property owners. And I'm just thinking through the role of government, and is it consumer protectionism, or is it, I hear the comments about public health and safety, and it seems to me like there's sort of this view that septic systems are bad, and that I don't agree with that concept. So I'm struggling with the idea that we need to provide this protectionism for consumers, and using health and safety as the reason. I don't feel like that's quite being genuine, because if there truly was this risk for the community, then we should be saying septic tanks aren't allowed across the board, and that's just not the case. So I just wanted to reiterate that it's not the health department performing the inspections, whereas like with regional building, they are the ones going out and inspecting, that think the work was done correctly. So anything that we hear today, I just want to keep that in context as well, that there are going to be motivations from folks, because if government mandates something, then that boosts business. So just kind of keeping that in mind as well.
So I just want to clarify something, because we do conduct inspections. We conduct construction-related inspections, and we do go out, like the difference is certified inspections, property sale. Our groundwater is a vital resource, and in a dry year, we're going to need to protect that even more. I think there's a fundamental difference on what central sanitation provides, because there is a layer of constant monitoring in central sanitation. Yes, homeowners are responsible from their home to the connection point in the street, but everything once it hits the street is consistently monitored through a lot of technology and different uses, whereas the difference for on-site wastewater treatment systems, and no, they're not bad. When they're properly maintained, inspected, and cared for, they provide a really good mechanism for wastewater treatment. But the difference is there is not a constant monitoring the same way there is in central sanitation. And so this is a mechanism to ensure that, yes, it's not a consistency. Yes, there might be times where properties go multiple years without being sold. This gives us an ability to identify those, to track those when they are sold. It's a predictable, not a defined. It's predictable inspection point at a time of sale. And so, I foresee our effort as our staff increasing in enforcement by not having a proactive approach and a reactive approach.
Thank you for the clarity on that. I did know that, and I misspoke earlier about inspections at time of construction. So yeah, thank you for that clarity, and also the clarity on the perspective of septic tanks not being bad.
Great. And Dr. Chan, I see that you've joined us online. Welcome. If you have some questions, go ahead.
Yes, I'm sorry I'm tardy, so I hope I'm not just repeating points that have already been brought up. But first of all, I'd like to say that with other home inspections, the home inspector does not take any liability for systems failing despite passing the inspection. And I think that it gives the buyer, especially a buyer who may not know how to properly use a septic system, I think it gives them false assurances that all systems are go, and um, and that they're not going to have a problem, because it is entirely possible that there's an unusual weather event, or the way that they're using their system is very different than originally designed, and it could fail. I think that if we're going to add a mandated layer of bureaucracy, that we should be providing some value for that. And that is making sure that the assurances the buyer is given are actually valid. And that would mean putting some liability either on ourselves or on the inspector, the certified inspector, to take responsibility for the functioning of that system for a specified period of time. I also think that it's not true that it leads to a cost savings. Many of these inspections will not turn up any problems, and so it adds an additional cost to a transaction. Also, if a problem is identified, it really doesn't save money in the housing system. Somebody has to pay for it. And whether it's the seller or the buyer, money is going out to address the issue, and it has to be addressed one way or the other. And I don't think that mandating inspections on every sale is going to make any difference. Um, I think that overall it has the tendency to drive up housing costs, which are already incredibly high in Colorado, and is impacting, I think, our economy in general in terms of people migrating out rather than migrating in. I also think that it's difficult to justify mandating this inspection because, as Kat mentioned, and was also mentioned in our work group, um, approximately almost 70% or somewhere around 70% of transactions were exempted because of the type of transaction it was. And if the argument that this is a public health risk, it should apply, it should be all or none. Either it's a risk or it isn't. And if you're going to exempt 70% of transactions, I think it's very hard to justify the mandate for the remaining 30%, simply because of the type of transaction it is, because the type of transaction does not change the risk profile for septic use.
Yes, Ms. Eagle.
Thank you. I just wanted to respond to one comment from Dr. Chan and just give my legal opinion that I don't think, if this program were to be adopted, that it would create any additional legal liability for El Paso County Public Health based on the inspections, the results of the inspections, or any work done in reliance thereon.
Any other questions or comments?
If we're opening up for comments, I have comment.
Yeah, go ahead.
Okay, so obviously I have an issue with government forcing an expenditure when government cannot provide data to a property owner, identifying what is specifically causing a health risk on the owner's property. Now, during this review we've done over the last 4 months, there's a much lower cost option that's become known. And that is, for a cesspool owner that passes a certified inspection, we can just drop in a septic tank in between the house and the cesspool. Significantly lower cost. And I don't know if that's really a well-known option or not. So, that's something that I actually want to encourage, basically. But also up where we're at, we have homes that are out in boulder fields. And I asked the question, is it required to have a septic tank below ground? And the answer was no. And so there's options potentially available out there for dealing with and mitigating cesspools, especially in where we have the boulder fields. Yeah, an above-ground option could be there. Yes, there are other issues that go along with it, but that's there are engineering solutions for that type of issue. So I actually, no matter how things go, I want to encourage people to deal with and get their their cesspool systems mitigated before they fail, because once they fail or collapse, you're into the really expensive option. And up in my neck of the woods, I'm getting reports of 50 to 60 thou minimum. And so something that could potentially be less than half the cost is getting some attention. And so that's my message that I want to make sure gets out. Deal with your cesspool before it fails.
And I appreciate that. And I just want to add a couple of points of clarification. We currently have no exemptions in our regulations as it's set up for property sales. So any property that doesn't go through this process is doing so against the current regulation. But we have no exemptions. And so I don't recall that statistic that Dr. Chan just gave. And I think it might have been more along the lines of the properties we do review, we have about a 70 to 30 ratio of identification of concerns and conditions which would benefit and improve the sustainability of the system to corrective conditions that must be made. 30% of those being the corrective conditions and 70% being those that would benefit the system. So we have very small amount of reports that come in that warrant no comments on the system operation. And then to the mayor's point, for the last 2 years since 2024, since we knew this was coming, we have done nothing but educate and work with our industry members about the options that we would be willing to consider and be proactive in working through.
Commissioner Geithner.
Yeah, I just want to follow up. I think I remember, and Dr. Chan can correct me if I'm wrong, but I think I remember the conversation and what she was talking about, and I think it was related specifically to cesspools in the Green Mountain Falls area. And so it was an argument of why we should continue the program. So I think we should be careful not to play games, because it was an argument about why we should continue the program, because it wouldn't affect these people, because most of them weren't subject to this because they were familial and different things like that. So I think that's probably what she was referencing. And again, we shouldn't play games with these arguments. Yeah. I think it is disingenuous. The reality is, we're saying it's super effective, but also it's not really deploying fun. But then we have a question about, well, it could catch if you have 2 or 3 kids that are coming in. You've told us it wouldn't catch those things. And so I think that's what I'm trying to get here on the record today, is this is a sum of a lot of conversations, and we have asked these very specific questions. Would this catch a situation? In that work session, we heard from multiple people, myself, also Vice President Salt, about talking to actual homeowners in the community and what they experienced. They were going through this program. It did not stop those things. That is the point. It isn't the point of whether we agree that it's important to have clean groundwater. The point is, does this policy actually do what we've been told it is doing and why it's important? And that's why we've asked these questions, because we are not seeing in the results of the policy that has been in place that it is necessarily getting the result that we're being told it should be getting. So I think it's really important, and I think for the public to be here and to hear that those are the discussions. This was not taken on lightly, and it's not something that we don't understand or haven't heard these arguments, but we have essentially over the last many months done the research, spoken to people in the community, and we don't think it's getting the results that it's needed. Regardless, I know we're rehashing this because this particular thing came up, and I understand, completely respect that the council member was not able to remain because we went over time previously, but I think we're rehashing those same arguments that we had. The document in front of us is the draft. The board gave the direction to remove that program. And so that is the draft that is in front of us, and I think, I don't think any minds are going to be changed on that at this particular point by continuing to have this discussion. Maybe there's something in the, from the public comment that will, but I just want to remind us that is what is currently in here, and that is the direction that has already been given to move forward so that we can hopefully vote on this today.
Yeah, Madam President? May I?
Yeah, go ahead.
Yeah. I just like to say I'm not playing games. I'm trying to do what's in the best interest of public health.
Wasn't even directed at you, sir.
Well, could I ask who it was directed at?
Certainly. I think that our staff member is playing games and not giving the complete, honest answers that she has given in past meetings, and that's what I was referring to. You asked a very specific question about it catching 2 or 3 kids if they did it, and I think it was like, maybe, but that was something very specifically in the past we talked about, and I think, again, to Dr. Chan's comment about there should be some guarantee if we were requiring that. And the answer was given, there is no guarantee because next week, if you are misusing that system, it could fail. And so that is what I am bringing up. That was not said as honestly as it has been said previously, and I'm disappointed in that because the reality is you asked a question that would catch it, this would solve that problem, and the reality is the flat-out answer is no, and that's what we have been told in the past. No, it would not solve that problem that you postured.
And my final statement, Madam President, is I think this will go better if we don't try to guess the motivations of others who speak.
All right. I do have a question for you.
Sure.
You mentioned you pulled the data from Green Mountain Falls. Can you just clarify for me? I'm like not sure I completely understood what you said.
Yeah.
Of the 24, 25 sales, there were so many and only so many had.
So what I did, and we talked about this in the work session, and we've done a lot of work around this, and so I will be the first to admit that I don't remember all of the conversations. That conversation was 3.5 hours long, and so my apologies, that is not my intent at all. When we talked about it in terms of Green Mountain Falls, I pulled the assessor data from 2024 and 2025. They had a total of 290 transactions in Green Mountain Falls for property sales. We only have record of 88 of those transactions.
Okay, so I was understanding. Thank you.
Yeah.
So then, because this program, if we have it, is not a legal part of the closing
It's
process.
not a legal part of closing.
So there could be people who are thinking it's happening and it's not. I mean, that's like a third.
Correct.
Well, I guess not more than a third, but less than half.
It's a significant portion, and we do fundamentally know this to be a problem. It's not a legal part of the closing documentation. This does historically rely on realtors. It does historically rely on closing companies. We know that these do not always occur. And that's not misleading or anything like that. It is something we deal with, and we have those conversations every day. We did talk about the exemptions as an original proposed to maintain the program at a transaction or at a point in sale. Our original proposal was to incorporate exemptions. My estimate was that it might be a 70-30 split based on the data I pulled just specifically from Green Mountain Falls because that was the area of concern. I know we've gotten O&M and property sales mixed up. I get those mixed up too. So my intent is not to mislead anybody. Those things may or may not be caught. That's the reality of the situation.
For sure. No, I appreciate that point because I think it's also important to remember we are not a legal step in the process. People can opt out to not do it even though we don't have an exemption.
Yeah.
And so making it voluntary is maybe more honest and true to the situation we already have anyways because people can close on their house without an inspection and there is no mechanism for enforcement. So I think that's important. I also want to point out I appreciate the automatic renewal and the waiving of the fees for the renewal of the licenses and the certification. We talked about that quite a bit, and so I really appreciated seeing that in there, and I hope that is a positive change that helps both clarity to the industry, but also empowers them to keep it in good standing and not have to have a burden of constant renewal. So thank you for doing that.
Absolutely.
Any other comments or questions before we move on? Dr. Chan.
I'm sorry to belabor this point, but I want to make sure that I understand the limited data that we do have. So in Green Mountain Falls, there were 290 real estate transactions in the previous 2 years. Is that correct?
Yes, that's the data
Okay.
that I pulled from the assessor.
Okay. And when you say that you have information on 88 of those, does that mean that there were problems identified that were reported to the Board of Health?
Those 88 had applications for the property sale review. So I don't have data on the number specific to what required repair and what didn't. I don't have that right now, no.
Okay. And so the other ones, the other 212 or so, 202, that you don't have information on, you don't know whether those were inspected because they were inspected by independent contractors. And so if they passed inspection or they were functional, if they were a functional septic or they were a functional cesspool, you would not receive any information in that regard. So is that true?
Not quite. The other ones, the 212 that didn't go through that process, just simply means that we did not receive any information. So we cannot tell you if they were inspected or not, or if they were functioning or not. We just have no information about them going through the process. Nothing was submitted to us.
Okay, so yeah, I understand that nothing was submitted, but what I'm trying to understand is it is possible that they were inspected and passed inspection, or at least a portion of them did, but you wouldn't receive that information because it was done perhaps at the behest of a realtor, and then the information was just shared with the buyer and seller and not with the Department of Public Health. Is that right?
I wouldn't be able to speak to that because I don't know that. I don't know if that occurred or did not occur.
Okay.
So,
and so you have information on approximately a little less than 1/3 of transactions that occurred in Green Mountain Falls, but you don't have any information on whether there were problems with that 1/3, or you do have that information, you just don't have it in front of you.
I could get it. I just don't have it with me off the top of my head currently.
Okay. Okay. And so prior to Rule 43, there was no actual requirement. It was up to the buyer and the seller and the realtor to decide if this is something that they wanted to do, right?
Prior to 2014, there was no requirement for inspection processes. And so if they chose to do it, they chose to do it. But the reason that it exists and was brought in as an optional program into the regulations was because there was an identification of it being necessary and needed, according to the state. I don't have specific data for that, though.
Okay, so for El Paso County, since 2014, was there a policy in place that required inspection?
This has been in our regulations since July of 2015, yes, ma'am.
Okay,
Shortly after it was brought in as an optional program to the state.
So despite being in the regulations, why were the majority of transactions not inspected or reported?
Yeah, I might be able to help clarify, Dr. Chan. There's a portion of the sales up in my area that are cash sales, and there's also probably a larger portion of them that are generational hand-downs. In other words, even in my own family, my parents bought property there up in Green Mountain Falls. They deeded it down to all 5 of me and my siblings. We have now deeded that down to my youngest brother. And so those deeded down items would have never shown up. Does that make sense?
Okay, so the title to the property did change hands. This is what I understood from our work group. That's where I got the 70%. I use the word exemption, although I don't know if that's the correct word to use. What I understand from our work group is that the majority of retitled properties or change of deeded properties were not inspected because they did not require that inspection. And again, my argument is if this is so important, it's an all or nothing thing. But the fact that for the last 10 years, we've been doing it this way, and there's no data to support that this is a failing policy, would indicate that the majority of transactions do not require the involvement of the Department of Public Health.
Ms. Siegel?
Thank you. I just wanted to perhaps help clarify what the policy currently is and what's being proposed, and just kind of restate in a different way what Kat has presented. Current policy is that every single property transfer go through this process. However, it is very challenging, if not near impossible, for public health to enforce, because absent a buyer or seller voluntarily coming to the agency and saying, I'm buying or selling this property and I need to go through this process, public health will never know that the property was sold and this didn't occur. And so it's just, there's really no way for us to catch it beforehand or catch it afterward unless someone comes to the agency. And what had originally been proposed for this regulatory update was to exempt a certain class of transactions from this requirement, even though they are not currently exempted. I just wanted to clarify that.
Ms. Ralston, do you have a comment?
From what I've heard today, and it seems reasonable that you're not an enforcement agency when it comes to this, and so it doesn't benefit, really, we can't show data for or against it, and I just don't think I think it's a homeowner's responsibility or the buyer's responsibility to be forthright. It's not something that we can enforce, so maybe it's not something we should be involved in.
Commissioner Nelson?
I'll be quick. I want to get to public comment. I want to hear from the community, but switching gears a little to the certification requirements, where we say that, which I am very grateful for the changes that you made on waiving of fees and continuation of certifications and just making it easier on people to work in this industry. I also appreciate that we do want individuals to remain up to date on current requirements as things change over time. And when we're speaking about licensed system contractors and the need for them to attend an annual meeting or training session during each year prior to their license renewal cycle, I would just put out the idea that we also provide something online that people could, just like a module that they could go through, and again, just trying to make it even easier on folks so that if our meeting doesn't tie into what their schedule allows, that as much as possible, can we meet people where they're at.
Yeah, for sure. And we do hold multiple sessions. So we do twice a year, generally January timeframe and October, November timeframe. And even within those multiple months, we hold multiple time slots available for those as well. But I can consider, maybe we can record and have some little exam or something at the end of that they can submit for credit.
Or like that they
like a documented
watch,
understanding.
Yeah, watch something online, and maybe it's they have to request a password from us to access it, so we know they actually did it. But I'm just thinking, if their license expires in December and they missed the October, how do we just, if we're going to require certain things of them, let's make sure that it's accessible as much as possible.
Yep,
It's just something to think about. Thank you.
All right, I think it is time to move on to our public comment portion of this hearing. We are going to have 3 minutes per speaker. Do I need to read this portion here, Ms. Higo?
I'm not sure what you're
The
referring
public,
to? So-
what we would state before public comment? No, I don't need to, okay. All right, so we are gonna have 3 minutes per person. If you could please, do you have direction? If you could please introduce yourself when you come to the mic for the record, that would be appreciated. And there's a sign-up sheet. Oh, there's a sign-up sheet on the podium. So if you could both state your name and then make sure to write it on that sheet, we would really appreciate it. We have a 3-minute timer. Don't. Thank you.
Hi, guys. Very good points. Very good points. I'm Pat Cobb, 15 Penrose Boulevard, 80906. Here's the way I look at the title transfer inspections. Might not be necessary, but everything that I do is about accountability. And everything that these people get when they do their inspections depends upon me or him or him or him. We answer the phone every single time it rings. So if I go out and I make a mistake on an inspection, I still want to answer the phone because they're going to call me and they're going to ask me about it. A lot of people don't do that. See what I mean? The county people, they're maturing. They're growing into their deal. They miss some things. They get some things right. But it's really good to have those guidelines. You know what I mean? It's good that the seller and the buyer can get together and we have these county guidelines. You know what I mean? We need to do this, this, and this. Okay, let's get it situated. As far as your thing goes, where you go to somebody's house and this little old grandma's been living there for 30 years, well, you know what? You're going to tell these people that are buying this house, hey, man, grandma's lived here for 30 years. You're going to buy a house that's been very, very mellow. There hasn't been much going on here. And then you're going to move in with your 3 kids and your new washing machine and all that business. You're going to stress the heck out of it. It's going to change the game. It's not about passing and failing. It's about information. So these people that are buying this house, they know, hey, man, we're going to have problems. Or they're going to know, this thing's going to last a long time. You know, there's no guarantees in this deal. I do it all the time. Somebody moves in a house, septic system, puts in a water softener. 3 months later, it's in failure. I didn't have nothing to do with that. You know what I mean? There's a lot of things that go on that we don't have nothing to do with. As far as the cesspools go, I think those should be on a case-by-case basis. Because there's a lot of them up there where nobody goes to the house for 9 months out of the year. There's no reason to mess with it. But I went to 3 in Green Mountain Falls the other day. They're dumping in the creek. So we need these things happening here. So everybody tells me, oh, it works just fine. Well, it doesn't work at all because it's dumping in the creek. You know what I mean? We need these people back here doing things and getting involved. And it's not all about the county people. It's about us having some sort of accountability and acting right out there. And not all of us do it. You know what I mean? There's a lot of things that go on that may be frowned upon. You know what I'm saying? So it's all about accountability, and let's all work together and get this done. But I'd hate to see some young couple move into a house, and then they need to come up with 80, 90 grand to put in a septic system when we could have solved the problem on the get-go. That's all I got.
Amen. Thank you. Just a reminder, if you could please state your name for the record and then write it down on the sign-up sheet.
My name's Steven. I'm with Arrowhead Septic. Again, to your point, if you have a home that originally was permitted for 3 bedrooms, we're going to catch on the inspection when they're selling it for 7 bedrooms, and it's not rated for that system. Family moves in, they're going to overwhelm that system, just like he was saying. Those are things we can catch and actually inform the customer on. Green Mountain Falls, it's a great area. I love it. I love how people pass down their generational homes. The cesspool with the septic tank in front of it turning into a dry well is a fantastic idea. There's lots of people up there that live in those homes year-round. They weren't designed for that originally. They have a 1,000-gallon cesspool. It starts to fail. The only way to catch it is an inspection. So I think it's an important system to really, really think about, because it does help protect not only the seller, but the buyer. And, you know, accountability is 100%. A lot of inspections get done informally, hey, you're good to go, and then it gets processed as a sale, and a lot of those companies really aren't worth their mettle. So that's kind of all I have to say. Thank you.
He's my husband, so I'm going to follow up on him.
Oh.
So once he's done.
Get big.
Can we sign in on one line together? Does that work? Okay. So we
If you could please,
personally were looking
could you
at
please state your name and bring the mic down?
Melissa Schneider, and I'm from Arrowhead Septic. We personally were looking at a home within the last 3 months that was selling for a 7-bedroom. When I pulled the septic report, it was 1,250 gallons. That is, there's buyers that are never going to know that's a problem if they don't have this inspection done and if they don't have the knowledge to pull the report. And at the same time, we had a realtor who works in Peyton, Calhan, the Elbert portion of our county. He was selling a home in the Elbert portion of our county. He was the realtor. He was selling it as 5 bedrooms. It had a 1,250-gallon tank. That was not going to be sufficient. So with talking to us, he did encourage the buyers to change what they were selling it for. But if he hadn't been knowledgeable enough to know that, a buyer, again, would have ended up with a system that they could not, that their tank could not support how many people were in their house. And then for the concern that it's not being enforced to have this PSAD issued, yes, that's true, unfortunately, that there's just not the resources. But title companies are informally supporting this and enforcing it. I get 2 to 3 calls a month from a title company where their representative is saying, where is the inspection report? I need a copy for this sale to go through. And then I would also finally say, about 3 to 4 times a month during the busy seasons, we go out to an inspection and the lids are buried, meaning that system has not been pumped or looked at since it was installed. Sometimes those systems are 20 or more years old and no one has ever pumped it, no one has ever opened it, and if this wasn't being required, then it would not have been caught. You know, and those systems often have a problem. The baffle's deteriorating or something like that, that no one would know. And when I did forward the email with the meeting minute, or with the red line proposals and all that, I received comments back from many realtors. I think I got 3 phone calls, probably about 5 or 6 emails thanking us for sharing this. And also, one of the realtors even posted my comment on Facebook and tagged Arrowhead saying, we need this. Not all realtors know that the property needs to be inspected. Not all realtors are going to enforce this, but they need to know. You know, they need to know it's happening. They need to know that this is a requirement to protect their buyers. And yes, so I think it's important. We live on septic. When we first moved on to septic, I knew nothing. And as now a septic company, I have a card that we leave with everybody that has septic tips. So inspectors who do the right thing are taking care of their people.
Thank you. Next. Please introduce yourself and sign in there on the sheet.
My name is Dennis Williams, the owner of Acme Sewer Drain and Septics. I've been doing this for well over 50 years. I've seen a lot of septic systems just go by. I've got a picture here of a septic system that has completely failed. And I can bring it up and let you take a look. If a young child or even an adult was crossing over the top of this septic tank, could have fallen in. This has happened in the past. This has happened in South Florida, where it killed a young child for falling inside of a septic tank. These inspections catch this before this happens, even though some people would actually say that these inspections are just a time shot in space. Yes, they are. But they also let the homeowners know, or the buyers know, what is going on with the septic system at that point in time, if they need to be addressed at that point in time. Damaging a house for hundreds of thousands of dollars because the septic system has failed is our responsibility to catch it before it happens. And having a life sacrifice because this has not been addressed or not seen, it's unacceptable. I've been in this business out here to where I've come out into properties to address an inspection and have actually been threatened by real estate agents because the system has failed. And they don't want the buyers to know. This stops it cold right in its place. I'm in favor for this program. This program helps the buyers, helps the sellers, safety of the public, and our drinking water. I don't think there's a question. I don't think there's anything about saying to anybody, is this system not working or is the system working? It is a safety issue, and it needs to maintain and be in our systems permanently. Thank you. Does anybody would like to see this picture?
We could see it pretty good. Thank you, though.
Thank you.
Commissioner Gardner?
Yeah, I just want to clarify that a seller who knows something's in failure and continues to sell it, or a realtor, while that is egregious, that's already illegal under Colorado law and would be enforceable through Colorado law, including that they would be liable for any of the cost that if they did not disclose to the buyer. There's a very robust disclosure law in Colorado.
All right, are there any more public comments? Yes, sir, please come on up, state your name for the record, and sign in on the sheet up there.
My name is Mike Murray. I'm with Murray Excavating. 31 years I've been licensed in this county. And my question is, why would we not have this? I mean, our county is above all the others in the state, and I've talked to engineers, you know, up north, everywhere. Why would we, if good people are going to get an inspection anyway, and realtors are going to push that, why would we not want it to be required? Because the only people that are going to benefit is people that are trying to sell something that's a problem. And I go out, my main concern is not the groundwater issue, which that is a big issue, but I go out to these jobs because most of our business is repairs and replacements. And it's all we do. We don't do other kinds of excavating or anything else. But I go out to a job and the homeowner comes out with me and their dog, their kids, and we walk out to where their leach field is, and there's a pool of sewage on the ground. The dog runs through it, he's drinking it, and then he goes back in the house. You know, these things need to be stopped, and no program is going to stop everything, but there's no reason whatsoever to stop this program. We've come a long ways. I've seen numerous times when I go look at a job like that, and then a few months later, I drive by, oh, there's a for sale sign in the yard. You know, 10 years ago, we put a stop to that. Not a stop, but we put we made it more difficult for people to do that. You know, there's lots of games people can play if they're dishonest. They get their system passed. They can pump their tank 2 or 3 times, let it dry out, go on vacation for a month, whatever. But it is helping the industry, and it is helping the public, you know, information-wise and requiring people to do the right thing. You know, if we're going to say that it doesn't matter, then why don't we just go back to not even having a permit, letting people install the system however they want, like in the old days, Black Forest. I've seen cars buried in the ground where they're just dumping the sewage into a car. You know, that don't even make sense, you know. We have law enforcement that protects us from bad people. We need to also have rules here. And whether you can enforce them or not, 90% of the people probably don't even know that it's not enforceable. So make a program. Nobody's going to be impacted monetarily that shouldn't be anyway, you know. So the bad thing is when a young couple buys a new house and they move in and then their system fails and they're out these big dollars that could have been handled at time of closing. Maybe they agree to fix it, but they can include that in their mortgage and it's done, instead of having a failed system. Sorry. That's all right.
Thank you so much for your comment.
All right. Thank you.
Madam President, could I ask the gentleman one question?
Sure.
Thank you. Sir, how much is, on average, I'm sure there's a range, an inspection of a OWTS system, just a range or on average?
You mean for the inspection itself?
Yeah, at sale, and when they're going to sell their house?
I don't know, because we I don't do inspections. My son and I, our partners, we have chose not to do inspections. We do the repairs. I just feel like that we don't want to do an inspection, then, but I don't know what the cost is, but I would guess less than 500.
Inspect your own repairs. I get it. That's ethical. But if one of the other speakers does know that, if we still have speakers, perhaps they could give us that range, because, you know, some have said this is raising the cost of housing to do this. It's driving up the cost of housing. I'm curious to know.
No, because we're doing it anyway.
350 to 450.
So what several of the witnesses just said is 350 to 450, 350 to $450. Okay, thank you.
Okay.
Thank you, Madam President.
All right, if you could please just state your name for the record and then write it down on the sign-up sheet.
Okay, let me deal with this. My name is Teresa McJilton, and I'm just going to write down my name real quick. I have lived in Black Forest since 2003, and I have lived on acreages out there, and I've had septic systems out there. I currently am on a septic right now. I also own Unique Septic Services. We are certified inspectors and certified haulers with the county. That process, I know we've had a little bit of discussion about what we go through. There is a training process, there is a certification, and it's relatively lengthy, and we have to get approved by CPOW. Also, there's national guidelines that we go through as well. And so to be certified with the county, there are a lot of steps to go through. We aren't just another level. The transfers of titles, I work with realtors, I work with lenders, and I work with title companies all of the time. I just have a couple pictures I want to show you of some worst case scenarios where we have inspected properties and what we see. And, you know, basically what I'm going to show you, I'll just pass them around. This is raw sewage on the ground. This is real. This is really happening. Some of these are near parks. One picture in particular shows a doghouse and kids playing. If we're not doing an inspection on these, people can buy this. They get to buy raw sewage on the ground. This gets to go into our parks. I'm going to quickly. Just did an inspection last week in Green Mountain Falls, and the gutters for the home are going on to the leach field. So all of the drainage from the house goes to the leach field. That starts to pool. That homeowner doesn't like the pooling, so we have, you know, rainwater from the gutters, and we have raw sewage. They don't like that pooling on their ground. They're selling their property, and they dug a little trench that goes into Fountain Creek. Fountain Creek goes through Manitou Springs. Our kids play in it. Our dogs drink out of it. This is a check and balance. And a lot of, there's a lot of teaching going on when we do inspections. We talk to the buyers. We tell them how often they need to have their septics pumped. We talk to them about having filters cleaned, things that maybe people wouldn't know coming into this area that doesn't have a septic system. And it does affect our groundwater. It does affect our parks. And, you know, we live in one of the most beautiful counties in the country. Why would we ever take a chance on having raw sewage on the ground and let that be a voluntary program? I know the VA lenders are still going to demand this. I do have realtors that want it on both sides. We tried having the potential buyer do the inspections, and we were shot at. So the homeowners don't generally want potential buyers to hire people to come onto their property and do an inspection. So it seems to work best to have the sellers do it. Also, when there is a repair needed, you know, we're submitting everything to the county's reviewing that, and
Can you please wrap up? Your 3 minutes is over. I know it goes by quickly.
It goes by
Just
quick.
final
All
thought,
right.
and then we need to move on. Thank you.
I just think that without this, it's going to be a buyer beware situation in our county, and that's sad. I'm Teresa. Thank you.
Thank you, Teresa.
My name is Brian Murray with Murray Excavating. Someone had commented about it's the realtor's responsibility to make sure this gets enforced. Realtors, some of them, yes, are honest and will do this. Some of them are not. And yes, I know someone had commented that's legally punishable, but only if it gets caught. There's too much of that that can not get caught. But also there's a huge lack of education for realtors, buyers, and sellers on septic systems. There's a lot of city people moving out to the country that don't have a clue what the components even of a septic system are. So a lot of this stuff just falls through the cracks. If you go making it an optional thing, buyer, seller, they both might not know. So making it a required thing that people can get some education on it through this inspection, whether their inspection passes or fails, is a very, very important thing to do. There's no pen up here.
How's it going, panel? I'm Nathan Neitch. I'm a certified inspector and installer in El Paso County and Teller and a couple more counties. And I just personally know from like my age group of people, I'm younger than a lot of the guys that have come up here and spoken so far. And I know personally, like as far as my age group goes, if this becomes a voluntary thing, people aren't going to just do the inspection. I mean, that's ridiculous. Why would I spend $400 or $500 on an inspection that isn't necessary? And then if the buyer doesn't say anything about it, why would I make it a point and do that on my own when it could cause issues with my home sale, it could cause issues with my property sale? And personally, as somebody who does installing and inspections and repairs and everything like that, there are a lot of times I go out to an inspection, a property sale inspection, that's a lot of our business, and a property sale inspection where they're not having issues necessarily, or they have a broken pipe to their leach field where that pipe has broken and now their leach field is before their actual leach field. Do you understand what I'm saying? Where all that wastewater is leaching out, 30, 50, 20, 10 feet outside of their septic tank and not even making it to their sanitary treatment area. You know what I mean? And so I just don't, personally, I think that this is a great way to enforce these. I'm sorry, you guys don't do enforcing, but personally, I think it's a great way to have regulations on a septic system before a property sale, because buyers are coming in where they're getting screwed because, there's a problem with their septic system and like the loads come in and, we have issues. If there's not a property sale inspection, there's no room for any kind of, what's the word I'm looking for? Yeah, any kind of issues being found, right? And so, like I said, I'm a younger guy. Personally, people I know, they wouldn't do that. They wouldn't have a voluntary inspection, just being honest, So I think this is a good thing to have these mandatory inspections at property sale because they catch issues and it's super informational for sellers and buyers all the way across. So that's all.
Hello, I'm Casey Simmerman, Bear Country Septic. I'm going to tell you about a phone call that occurred 4:45 last night. Homeowner called me and said, "Are we supposed to get an inspection?" I said, "Currently, yes." She said to me, "Okay, we have a problem. The leach field has failed since we bought it 2 years ago. We have sewage out on our ground for 2 years because the realtor, and my wife's a realtor, didn't know better. So realtors don't know enough, and they're not catching them. As far as my monetary greed, I told her to wait till July because this may go away. Save your $700. So there are honest people out here telling you true stories. I have another realtor They escrowed a check for me to pump a tank because they know it's failing. Why hasn't that been fixed? If the realtors are honest, and all these people are honest, why am I getting escrowed a check to pump a tank that they know is failing?
I'd like to ask a question, because first of all, I mean, we've had a lot of comments around honesty and those things. At the end of the day, you're absolutely right. There will be good and bad. I don't care which industry that you are in, and that is something that it's just something that we deal with all the time. But you said that the seller told you that their realtor didn't know, so they purchased the house 2 years ago and it was already in failure.
Yep.
Why did the title program not stop it then?
The realtor didn't know that it needed to be inspected. The homeowner didn't know that it needed to be inspected. The buyer did not know it needed to be inspected.
So, but the title program was already in place at that time.
There's no teeth.
Okay,
The
so now we're
realtors-
getting, hold on.
Yeah.
So I think you're saying what I'm saying, there is no teeth to this program.
Correct.
So what I'm saying is, if you're telling these stories that this needs to remain in place so that doesn't happen, but it was in place and it does happen, how does this program solve the problem you just told us?
Because all these stories are the catches. And if we catch one, turn around and look at your banner. What does your banner say? Public health. If you can't live up to that, why should any of us attempt to live up to that? We believe in that. You should believe in that. Okay? And if we catch one, just one kid from getting cholera, from running through sewage, then amen to Cat. It was a program well worth it.
I think I got my question answered. Thank you.
Yeah, thank you, Casey Zimmerman.
It's an imperfect system that needs some improvements.
Okay,
but it doesn't mean
we're
it
not
needs to
we're
go
not going to
away.
speak from the audience. Thank you. Thank you. Thank you. Is there anyone else? Let's continue. And did the previous gentleman, did you sign the form? Okay. Thank you.
Yeah, my name's Doug Pretzer with Colorado Geosolutions. I'm an engineer, not an inspector. So I know you guys wanted to hear because you think sometimes people have motives behind me. There's a public health element to this. I'm not making money off of telling someone their system's failing or that it's working. But from an engineering perspective, you want to protect the groundwater. You want to protect the public, and this type of program helps that. I think there's a better way that we can enforce this, give that program teeth, make sure that these are being done, but I don't think making it voluntary is the solution.
Mrs. Ralston, go ahead. Sir, you have a question from the board.
So can I ask you, so what, you said that there's a solution, so what is your solution that you offer up for
That seems more public health policy and legalities that I don't know a solution. I'm sure there's a way to do it, but that's beyond my ability.
Thank you.
Thank you.
Anyone else? Yep. Okay.
My name is Tim Galvin with Underground Solutions. I've been doing inspections for over 25 years. I've sat through a number of your work sessions, hours at a time. Thank you for taking the time. So if we don't report, some customer has an inspection done and never finds out the results, and maybe 5 don't. So do we get rid of the program because 5 didn't do it? If a doctor misdiagnoses someone, do we get rid of the medical profession because it doesn't work 100% of the time? Is that the logic behind this? I don't think so. So also, it's voluntary, but you know, we catch so much stuff. I would say if Kat had the stats, a lot of stuff is not, you must fix this, but here's a deficiency. It's not quite right, and if you don't fix it, you are going to have a more serious problem. Systems went from $10,000 to $12,000 in 2014. The state reclassified decomposed granite to type R soil. Those same systems jumped to $20,000, one definition. Now those systems are 30 to 40 in Green Mountain Falls, where I do a huge amount of work. They're way beyond that. Some systems, you're not going to put a septic tank between the house and the cesspool. It's never going to happen. I see, I won't say hundreds because that's an exaggeration, scores of cesspools in Green Mountain Falls. Have a lot of people that live on them 365. Some are still seasonal. Some are not insulated. You couldn't live in the house in the winter if you wanted to. Okay? The department has worked on variances. I think that's going to be a sticking point. I see the only reason, really, that you're going to get rid of this program is so you don't have to deal with cesspools, because then you're not bound by Reg 43 to do that. That's what I've listened to for 2 meetings, okay? This system catches a lot of bad stuff. It saves homeowners. Is there a cost to fix it? Heck yes. Is it less than $30,000, $40,000? Heck yes. But to get rid of the program, I don't see that as a step forward. And it is protecting environmental health. We've had so many stories of dogs and everything going in, running, bringing stuff into the house. People don't know. Okay, realtors, I have huge respect. A lot of realtors are great friends of mine, and they're ethical to the nth degree, but a lot of them are not. Some of them do it out of ignorance. I could tell you story after story, okay, how of this happened. Not necessarily hiding something, just not knowing. At least we have a program that does fire on some cylinders, maybe not all 8 out of 8, but to get rid of it, I don't see how we're moving forward, how we're doing anything better for our customers. Thanks.
I'm John with J&K Excavating. It's a very good program. El Paso County started this program. Everybody, Mike and Brian said in here, everybody, it's true. There are so many things that get caught during these inspections. It's incredible. Realtors are not always responsible, honest, trying to just get a sale. I don't know how you get rid of a program like this that El Paso County has started that should be extremely proud of. And now Douglas County, Teller County, and Elbert County has just made this a mandatory program. So I don't know how you step back in time and say, we're going to step back, and they just put this into their code. Thank you.
Thank you for the opportunity. Got to get the mic right. Thank you for the opportunity to provide commentary on the proposed Chapter 8 regulation changes. I'm Lisa Nickel. I'm the Educational Coordinator for Colorado Professionals in On-Site Wastewater, also known as CPOW, which is a group that includes all sectors of the OWTS industry with the goal of promoting best industry practices, advocating for appropriate regulation and policy at the local, state, and federal level, and fostering professional partnerships and networking. Over the years, CPOW has grown to several hundred members and is the staple provider of OWTS training for the industry in Colorado. The recent 2025 census shows that El Paso County has a population of over 750,000 people, occupying more than 320,000 housing units. El Paso County Health Department has identified over 35,000 active OWTS systems in their jurisdiction, which means that roughly 10% of the housing units in El Paso County are currently utilizing an on-site wastewater treatment management system. The use, function, and need for repair will be specific to each individual system, but each system has the potential to impact the natural resources for the entire county, specifically with regard to shared groundwater. Malfunctioning OWTS can contaminate the groundwater for not only residents in the immediate area, but those drawing water from any impacted wells or aquifers. It's vitally important that these resources are protected and that the sources of potential contamination are monitored by the appropriate entities, like with the use of a title transfer or use permit program. Title transfer programs like the Property Transfer Inspection Program in El Paso County provides an avenue for regulatory agencies to identify active OWTS in their jurisdictions, monitor the continued function of those systems, and help mitigate any potential pollution into groundwater or other natural resources. There are currently 30 counties across the state of Colorado that have implemented a use permit or title of transfer program as part of their home sale requirements, which is allowing them to track those active OWTS in their jurisdictions. Comments from some of those counties about their programs include noting declines in the number of failed systems and systems needing repair over time. They have also found that it is harder to determine failures after the point of sale, let alone trying to correct those failures when the buyer is left with a large repair bill soon after the purchase of their new home. With the current program in place, El Paso County has actually seen an increase in homeowners seeking early inspections and addressing preemptive repairs. Getting inspections is an expected part of a home sale, and requiring sales transactions for homes with on-site systems to include an inspection as part of that process can help address concerns about potential repair costs, when capital and equity is more likely to be available for potential repairs to the system. The reality is that OWTS failures can impact residents across El Paso County, including folks that live beyond the boundaries of areas like Green Mountain Falls. Of the over 35,000 active systems on record with El Paso County, less than 1% of those systems are in the Green Mountain Falls zip code, an area that covers approximately 1 square mile within a county that spans over 2,100 square miles. Their unique topography and history is being used to determine the future of a program that applies to a much larger area and populace than just their estimated 875 residents. All county residents can be impacted by groundwater contamination from malfunctioning OWTS systems. Instead of completely removing the program or making it voluntary, CPOW is urging the board to consider providing variances or other solutions for these minority populations with unique restrictions or conditions, like those located in Green Mountain Falls. Removing the requirements of the program and making it voluntary has the potential to impact thousands living in the El Paso County borders. In the words of Representative Jim Clyburn, environmental protection doesn't happen in a vacuum. One can't separate the impact on the environment from the impact on our families and communities. Thank you.
Thank you.
I'll just sign my name real quick. Oh, I'm taking my pen.
Anyone else, please come forward. Have we heard from, okay.
Good morning, ladies and gentlemen. My name is Paul Clifford. I've been in the system now for 30 years. The inspections that we do aren't generally misguiding. They actually do find a lot of stuff, especially on the older systems, stuff that's been out there for over 50 years. Most of the time, we find a lot of systems that have problems that we can correct early and save the systems, save people money. Also save potential lawsuits down the road. And that's what we're opening ourselves up for if we cancel this program. We're opening ourselves up to a lot of lawsuits because ultimately, you guys are responsible for the health and safety of this county. And that's what you're going to be seeing a lot more of. Failed systems that fail early or fail in a short time after a buyer buys the home because of sizing or misinstalled, something broke. You brought up something early on a house, 2 people in it. Now you got 7 people in it. System fails. That's part of the potential of what we can, as inspectors, and you guys can determine if the system is going to have a problem down the road. And we can inform the people and the customers that we have a problem, we can address it. Maybe save the system without big costs. Mr. Galvin brought up that point too. The more we can do to save people money, time, and headaches would be a lot better than what we're going to plan on doing coming down the road. Getting rid of this program, not a very good idea. It saves a lot of headaches. Thank you. Thank you. Sorry, I'm blind.
Okay, anyone else? Last call. No one online? Okay, we will close the public comment period of the agenda for Reg 43. Thank you all for coming, sharing your stories, and having a discussion with the board. We will now move on to board discussion before we move into our voting for today. So I'll open it up to the board.
Can I just ask?
Commissioner Nelson, yes.
Can I just ask for like a 5-minute recess for a comfort break?
Any opposed? I think that sounds good. Thank you, Commissioner Nelson. 5-minute break. Way back to our seats, and we'll get started in just a couple minutes. We'll go ahead and get started. I need my gavel. Oh. There we go. It's like, if only I had a gavel. I know. Thank you, Kat. Alrighty, we will pick up where we left off. We have 2 agenda items remaining within this part of the discussion, which is we'll move into board discussion, and I will welcome folks. Please raise your hand. I'll call on you, and then we'll move into motion and a vote, and then that will end out the day. I do want to start with some comments. Just for an introduction, my name is Hunter Barnett, and I am president of the Board of Health. I apologize for missing the majority of the discussion, but again, I do want to thank you all for showing up. This is very important to hear your voices and to share your stories. 2 things, though, I do want to share with everyone in the room and online. The first is that we have not taken this lightly. If you have attended previous meetings, or at least done so virtually, or seen the recaps, we have been discussing this at length since January and have done so every single month. We have done so as an agenda item. We have done so consulting legal advice within executive session. We've had multiple working sessions. So today is a culmination of all of those efforts and considerations and discussions. The second is this: we can revisit this and any part of it at any time. We're fulfilling our statutory duties today in preparation for deadlines in the coming months. But again, we can revisit with updates, and I would encourage you all to let us know how things are going, depending on how we vote here shortly, for impacts of any changes that may be coming out of this vote. And then we can revisit changing a vote at any time. So nothing that we discussed today is permanently set in stone. So I just want to be clear on that. This is not taken lightly, culmination of 5 months of work on this board, and that we can revisit this and any part of it at any time. So with that, I'll open it up to board discussion. Who would like to kick us off? Or if anyone has any thoughts, question?
I'll
Yep.
just
Go ahead, Mrs. Ralston.
say a few things. I just want everyone from the industry to know how much we appreciate your being here and sharing your perspective. That from what I've heard today and what we've discussed and the information that Kat has provided us previously, it seems like, if this is correct, that a lot of the title companies are already requiring inspections, and that's a good thing. And I know that inspections are a point-in-time snapshot. Things can come up later. I mean, that's a given that I think I've heard. There isn't an enforcement component, which to me is the biggest obstacle for me how do you enforce something when we don't have that ability? And we can encourage it. We can educate realtors. We can educate homeowners. But even though we have a program in place now, and I realize that everything's not 100% perfect because we're all not perfect and systems fail. But unless we can devise a way to enforce, I just am not for keeping the program. I think if it's already working, can still work on a volunteer basis.
Vice President Salt.
Yeah, I want to thank all of you for being here today as well. A lot of the concerns that you brought up are questions we had. None of us are in favor of sewage, raw sewage, floating through our communities. That's just not the reality. What we are faced with is the mechanism of policy and the role of government and how are we doing this effectively. And I think by calling it mandatory is disingenuous because there are no teeth and we are not and cannot be a legal mechanism in the closing process. And so when you can say 30% of the homes in Green Mountain Falls didn't actually provide an inspection with a mandatory program, that feels very disingenuous. And so we're not removing it, we are making it voluntary, and I would love to see solutions coming from the industry because we really don't. And as long as we have this kind of illusion of a requirement, people can find their way around it. And so the need for education is huge, and that's something that we've brought up many times. And how do we improve education, especially because your customer is the seller, and it's not the buyer. And the buyer is then the person living in the home using these systems. And so improving education for the buyer is so important, and that's something that I have brought up many times because most people don't actually know how to use their septic systems. They don't understand how their leach field works. I have many friends who've wanted to plant their garden on their leach field, and it's just people don't understand. And so like the concerns that you're bringing to us, we see, but I agree with Ms. Ralston. We don't have a lot of mechanisms to really enforce anything, and so I think this is an opportunity to see how can we do this better so that we aren't ending up with 2/3 of sales with no information. And even when they are getting inspections, all of you represented in the room discussed telling both the seller and the buyer, but you don't represent every single person. And just like there are bad realtors, there are bad people in every industry. And how are we really helping these buyers? And so I would love to see some more industry solutions. I would love to see more information coming forward. But again, I feel like to continue a mandatory program that's not actually mandatory does not feel like good policy. And so I'm in favor of continuing to keep it out at this point.
Thank you, Vice President Salt. We'll go online. Dr. Chan, go ahead. Dr. Chan, you're on mute.
Okay, thank you. I'd like to say that for the persons that commented, I see a lot of truth in what they say. There's no question in terms of public health that prevention and maintenance is going to be much more effective and much less costly than closing the barn door after the cows are out. That said, I don't think that the representation as this being a binary proposition is necessarily true. I don't think that it's a choice between creating a mandate versus having children drown in failing septic tanks. I think that there's a third option, and that is responsible home ownership. I don't think that there's a single person on the board who would buy a property with a septic or cesspool without an inspection. And I think that most people who become responsible homeowners would want the same thing. I support not only preventative inspection and maintenance at the time of sale, but also at regular intervals during the ownership of the home. However, I don't support mandated inspections at the time of sale, because I don't think that it necessarily does the prevention and maintenance job that we want. I think that um, general responsible home ownership does that. Um, I think that there's been a lot of truth all around, but I think that there are solutions that do not require government intrusion.
Commissioner Geithner.
Yeah, I really appreciate the comments of the other board members and have similar thoughts. I think it's important, and I really think Dr. Chan said it well. You can support inspections, think that maintenance is a good thing, and also not think that this particular program and policy is the way to go. And I think that is a bit of what we're talking about today. If we were talking about some of the other things that public health has dealt with over the years, mask mandates, for example, didn't support those. If you were sick and you want to go into a hospital and you want to wear a mask, great. Did I support mandates from public health? Absolutely not. Do I think that people should take care of their health in lots of different ways? Absolutely. Do I think that we should mandate those things? So one individual made a statement, should we abolish the entire medical industry because they get it all wrong? But see, again, this is a false dichotomy, as Dr. Chan said. It's really what you're asking is, should we mandate everyone have an annual health exam? Because that's what we're doing here, or trying to do here. And so again, we can speak to the importance of certain things, but not think that a mandate is the best way to approach it. Public health here has talked so much about education, education, education. I agree it is a false sense of security for people to think that this program is in effect when they don't understand it. I would rather us focus on educating folks, educating more realtors, and I've heard people say there are some that are good and some that are bad, as there are in your industry and some of you mentioned. That is something that we deal with all the time. But education and empowering people to make good choices as homeowners is, I think, the most impactful thing that we can do. So far from saying that it is not important, I actually think it is so important that to stick a mandatory label on it and say that's good enough is actually a dereliction of duty here. I think that we really do need to focus on, I know that Deanna and I talked about this, how do we get out more in the communities? How do we get out more to Green Mountain Fall? How do we tell people about the preemptive ways that it can save them money? You know, people are generally looking out for their own interests. And so when we can explain to them why it's beneficial to them, they're going to be more likely. And so I'd rather spend our time and energy on education and helping people be successful when they are purchasing those homes. There are just some things that did not ring true to me. I appreciate it. This is always an important part. As a commissioner, it's always an important part to hear the arguments. And I always want to weight those. And sometimes people surprise me with things that I didn't think of. And I really appreciate that. But I want to just point out some of the things we're talking about, and that Vice President Salt mentioned about the seller being the person that is getting the inspection and the buyer. And I understand the arguments of why the seller needs to do it, though I also am very concerned to hear, you know, some of the stories, and I've been shot at. I mean, that's happened to our public works department, so I'm not saying that those things don't happen. I completely understand. I grew up in a rural area. I get that. But if you're selling your home, likely you are having to let someone on to inspect your home in other ways as well. That's a pretty typical thing. So you would be in coordination with that seller, and that should be something that if a buyer says, hey, I'm interested in your home, but I want to have this inspection, and I'd like to make sure that I'm getting the results, because that is key. If the buyer doesn't get those results, that is key. And the seller refuses, most people would be concerned about that and say, well, maybe this isn't the house for me. If you don't have a seller who is willing to let you come in and do inspection. There are so many things that can happen in homeownership. That's why we have general home inspectors as well, right? And that's why they're hired oftentimes by a buyer to ensure that they're not buying into a big problem, though it still happens. Those are all realities. But I have equated this before, and I will say this again. There are plenty of things that can be dangerous in a home that we do not require inspections from the government. I am the chair of regional building. Mayor Dixon and I serve together on there, and just thinking through how we operate from that perspective, we don't require an electrical inspection when you sell your home. That doesn't mean electrical can't be incredibly dangerous if someone has messed with something in the home. Those are all realities. They can cause fires. They can affect your neighbors in those ways. And so again, I come back to what is the role of government in this situation, and is this the right program moving forward? And I just keep coming up with, I don't think that there is enough data to support that this program is necessary, and I do not think that there is enough evidence that we have seen that says that this should be a mandate. And again, because it's not a real mandate, and it does absolutely create a false sense of security. If you are told this has to be done, but it's not, and you're just assuming everything is okay. Also, I've heard so many of you, and I completely agree with you, that what would be beneficial is if an inspector walked the property, walked this, and had a buyer there so they could say the things like, now here's how you need to use your septic system. But what we've been hearing is that is not what is happening. So again, I would like to see us educate people and say, hey, don't settle for a seller just saying the septic system is good. Request more information. Request how you should be operating that. And I would like to see more of that, because I do think, just like we have talked about, it's a snapshot, and how you use your system is going to be so impactful to what happens there moving forward. So I don't want to just focus on this, though. I also want to say we glossed over some of the other things that I think are really valuable here, that we are trying to remain as flexible as possible, both with the O&M as well as the variances. And hopefully some of you will appreciate that we are working to make the licensing process more simple, and similar to how regional building does operate, with making sure that renewals are seamless and are kind of automatic as long as you are a good actor. And I heard a lot of you kind of reference that as those who are doing a good job and doing what they're supposed to do. We want to reward that behavior. And if you're not doing those things, we want to make sure that you're re-educated on the topics that are important, so that we can make sure that we have the best services being delivered to our community. Thank you.
Thank you, Commissioner. Got it. Mayor Dixon.
Yeah, first, thanks everyone for all the comments, especially highlighting where we may have existing failed systems. To me, that really probably ought to be maybe a focus of ours, is trying to figure out a process to deal with existing failed systems that's completely outside of any sale or anything. I know if there are, that was mentioned, there was 3 that were dumping into Fountain Creek. We need to get that dealt with as soon as possible. And so developing a process to deal with existing failed systems, to me, ought to be one of our focus areas. So that's just my comment.
Councilman Donaldson.
Why don't you go ahead? I'm happy.
Councilman, go ahead.
Great.
Yeah.
All right, well, thank you. And first, Mr. President, I'd like to ask if we could have Dr. Meyer come up and just speak about the public health consequences of sewage on the ground or failed systems going into the groundwater. 3 minutes.
I think that is fine if we keep it to 3 minutes.
Hi, so I'm Paul Mayer, Medical Director of El Paso County Public Health, and I was trying to think of what I could add to the conversation, and a couple of things. One, I think it's interesting that the whole field of epidemiology traces its origins to a contaminated drinking fountain in England, actually. So it is true that, clean water is incredibly important, but I don't think there's any disagreement on the board on that. And I think the board has clearly spent a lot of energy looking at this and doesn't take the decision lightly. The one thing I would suggest to the board to consider is you know this, but the fact that you don't have data to say something's true doesn't mean it's not true. It just means you can't prove it. You can't show that. And so if you decide, whatever you decide today, especially if you decide to make a change, I would encourage you to consider trying to get some baseline data, make your change, and then revisit and look at data down the road. It'd be nice if we did that more as we'd made policy changes, because then we would have the data that you're so frustrated you don't have right now to make your decision, and that could guide you better. As you mentioned, you could revisit this in a couple, 3 years. And if you had some baseline data, you make your change, then you can make a better decision down the road, and I think that might be really helpful, to be honest.
I think that's a great idea.
And then, of course, any questions?
Let's discuss it.
But
Get on the list.
That's really it for me, Dr. Meyer, but could you just go over a couple of diseases that, what's the big deal about dogs running through sewage on the ground? And they kind of wipe it off their feet as they head to the house, or kids?
Well, a good summary way to look at that is, as most of you probably know, the big advances in longevity were made not with antibiotics and modern medicine. They were made with clean drinking water. If you all had to choose between me and Kat, you should choose Kat. She's going to add more years of life to your citizens than I ever will, and that's really true. There's good data on that. So it is critically important. All kinds of diseases, cholera, just a million different things that are spread through, unclean water. And, once you've contaminated an aquifer, Kat could tell you better than me, but it can be a real problem because now everybody in that aquifer has to put in mitigation systems, and you've really affected a lot of people. So the impact is huge. It can be very long lasting. Things like norovirus can last for a very long time in well water. So once once the cat's out of the bag, you have a big problem, and very hard to mitigate that later on.
Thank you, and I saw the pun you did there. You said once the cat's out of the bag. That was a good
was
one.
unintentional.
All
I'd
right.
like to take credit for it, but I cannot.
Thank you. Thank you. That's probably 3 minutes. And so, we are the Board of Health. I think that should be our focus. It shouldn't be ease of transactions in real estate. It should be health. We shouldn't become a burden, but we can't neglect what we're here for. While we don't inspect electrical systems on homes, we do inspect restaurants, right? And the reason we do that is because of the impact on public health. People go there, and that's something that public health takes as our responsibility. We inspect them. Is it convenient for the restaurants? No, probably isn't. Sometimes they get closed down. But I don't think we're going to stop doing that because it's inconvenient. Home buyers, like when you put the burden on the home buyer, and the reason we're in this is because of the impact on public health. It's not about housing sales, and it's the impact on the water or disease, which is transmitted when septic systems fail. But young home buyers or inexperienced home buyers, they want a home. They're not going to be, I think we make a mistake if we put the burden on them and say, public health will now wash our hands. This is totally voluntary. Be limited, and I hear others on the board saying we need to do more. We should have periodic inspections. I think Dr. Chan said that. I would support that, and I would support both of those things, maintaining what we do now, but increasing education and looking at enforcement. What can we do to make sure this happens more than it does now at the time of sale? Let me take a look here, because I wrote down a few notes. One thing I wanted to say is that all the speakers I thought were very informative. Miss Lisa Nickel, though, geez, that was a great presentation you did there. One of the speakers pointed out that just because we're not doing enough, that's not the reason to say let's just make it voluntary. So, I can't support that. The fact that 30 other counties in the state, have a mandatory program at the time of sale, I think we're heading in the wrong direction if we go backwards on this. I think the original recommendations from CAT, from staff, was to keep this requirement, but create some exclusions or create some exceptions. And I'd be happy to have Kat come back and remind us of what her initial proposal was. That's what I think we should do. I mean, this is the Board of Health. I think this does impact public health. Those were kind of concerning words by Dr. Meyer, that once this gets into an aquifer, it can be a real trouble to get it out of there. Another reason to go slow on this. So I also wasn't in favor of masks during COVID. I made quite the scene on this Board of Health with not supporting some recommendations about mandatory shots. But to me, this is different. And we're changing what we have now. Currently, we require this. We've heard lots of testimony on things that we don't think of and we don't see. But I think we need to listen to what we heard, slow down, keep what we have, find ways to improve the system, find ways to exclude or make a special situation for a community like Green Mountain Falls. But I'm encouraged to hear, yeah, we need to deal with what's going into the creek right now. This is one way we find out about that. So I won't be able to support it as it is. If we want to hear from Kat again, be happy to do that. I don't know if others do.
I don't think that's necessary at this time, unless the board would like to continue to hear from Kat. Commissioner Geithner?
No, I'd like to make a motion to approve the regulations as the draft is presented.
Is there a second?
I would like to second that with a slight caveat that we give direction to staff that if there are grammatical errors, as there have been a lot of changes, or any references that are maybe not correct, that they have the authority to change those minor things without it coming back to us. So that would be my caveat to the motion.
Okay. So there's a motion on the table to adopt. Oh, go ahead, Kat.
I was just going to ask if the original motion maker accepts that change.
Yeah, I think that's fine.
So there's a motion on the table to adopt the Chapter 8 of Reg 43, the most recently amended May 27th, 2026 version, effective July 11th, 2026, which includes the board's recommendations from last meeting and de minimis edits that does not substantially change the document that staff can make. Do I have a second? Oh, Vice President Salt has seconded Commissioner Geithner's motion. All those in favor, say aye.
Aye.
Aye. All opposed? Nay. Dr. Chan, how did you vote? I apologize, I did not catch that.
Aye. Aye.
Okay, the board has adopted the motion with one objection. Okay. I believe that's all the business we had for this. We do have one comment that Director Ryberg would like to make before we adjourn.
Thank you. I just wanted to speak briefly to our June meeting. June reflects our state fiscal year contracts, and I just wanted to remind board members that contract information packets are provided. You have received a link to those, and please review those in advance of our June meeting. We will be bringing forward those slate of contracts.
Thank you, and we will, yes, before we adjourn, Commissioner
Question.
Nelson.
I saw in that list of contracts, there were also some grants that we are receiving, and am I correct? Or
Yes,
go ahead.
we consider them grants. We're approving the contracts.
Okay. I'm contemplating whether to ask if we could get information on what the requirement of those grants is for matching dollars that El Paso County Health has to then, if that is the case with any of them, with any of the contracts.
We will review that to make sure it's included.
Okay.
Off the top of my head, I am not recalling any that have a matching requirement.
Okay, great.
But if so, we will make sure that that's reflected in the packets.
Thank you.
Okay, we will see you all at the June 24th meeting. This meeting is adjourned.